Diabetes is a condition that impairs the body's ability to process the blood glucose. The most common types of diabetes include type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes, also known as juvenile diabetes, it occurs when the body does not produce the insulin. Insulin is a hormone which is responsible for breaking down the sugar in the blood for use throughout the body. A person living with type 1 diabetes may be diagnosed during childhood. People living with type 1 diabetes need to administer insulin on regular basis. Successfully managing blood sugar levels can help people living with type 1 diabetes avoid serious complications. Some common complications include diabetic ketoacidosis, nerve damage, issues with the eyes, increased risk of skin infections, issues with the kidneys, cardiovascular disease, foot problems including numbness, high blood pressure, as well as stroke. Now, type 2 diabetes. People with type 2 diabetes do not make or use insulin effectively. This is the most common type of the diabetes and it has strong links with the obesity. A person living with type 2 diabetes may or may not need insulin. In many cases, medication along with changes in diet, exercise, lifestyle can help manage this condition. Anyone, including children and adults, can develop type 2 diabetes. The most common risk factors for type 2 diabetes include age 45 or older, overweight, family history. Gestational diabetes. Gestational diabetes occurs during pregnancy when an individual becomes less sensitive to insulin. Individuals who are overweight going into their pregnancy have an elevated risk of developing this condition. Around 50% of the people with gestational diabetes can later develop type 2 diabetes. During pregnancy, individuals can take effective steps to manage the conditions, which include staying active, monitoring the growth and development of the fetus, adjusting their diet, and then monitoring the blood sugar levels regularly. Gestational diabetes can increase the person's risk of developing high blood pressure during pregnancy. It can also cause premature birth, increased birth weight, blood sugar issues with the newborn, which typically clear up within few days. Increased risk of the baby developing type 2 diabetes also later in the life. Prediabetes. Prediabetes or borderline diabetes occurs when the person's blood sugar levels are elevated but not enough for a diagnosis of diabetes. An individual must meet the following criteria, like glucose tolerance level of 140 to 199 mg per deciliter of the sugar and HbA1c between 5.7 to 6.4 and fasting blood sugar between 100 to 125. People living with prediabetes having a higher risk of developing type 2 diabetes, but they do not usually experience the symptoms of full diabetes. The risk factors for a person developing prediabetes and type 2 diabetes are similar. They include being overweight, family history of diabetes, having a high HDL lipoprotein cholesterol level lower than 40 or 50 mg per deciliter, a history of high blood pressure, having gestational diabetes, a history of polycystic ovarian syndrome, PCOS, being more than 45 years of age, and having a sedentary lifestyle. Prevention. A person cannot prevent type 1 diabetes. However, people can take effective steps to help prevent type 2 diabetes, which include like maintaining a moderate weight, eating a balanced diet, low in added sugars, low in saturated fats and processed foods, exercising regularly. While these steps can help, it is important to note that people may still develop either type 2 or gestational diabetes later on. How insulin problems develop. Insulin allows the glucose from a person's food to access the cells in their body to supply the energy. Insulin resistance is usually the result of first, a person has genes or an environment that make it more likely for them to unable to produce enough insulin to cover how much glucose or sugar they eat. Then second, the body tries to make extra insulin to process the excess amount of the blood sugar. Then third, the pancreas cannot keep up with the increased demands and the excess blood sugar starts to circulate in the blood, causing the damage. Then fourth, over time, insulin becomes less effective at introducing glucose to the cells and blood sugar levels continue to rise. With type 2 diabetes, insulin resistance takes place gradually. This is why doctors often recommend making lifestyle changes in an attempt to slow or reverse this cycle. Steps a person can take to stay healthy with diabetes include eating a diet which is high in fresh, nutritious foods including whole grains, fruits, vegetables, lean proteins, low-fat dairy products, and healthy fat sources such as nuts. Avoiding high sugar foods that provide empty calories or calories that do not have any other nutritional benefits such as sweetened sodas, fried foods, and high sugar desserts. Refraining from drinking excessive amounts of alcohol or keeping intake to less than one drink a day for females or two drinks a day for males. Engaging in at least 30 minutes of exercise per day on at least 5 days of the week such as walking, aerobics, riding, bike or swimming. Recognizing signs of low blood sugar when exercising include like dizziness, confusion, weakness, profuse sweating. Some people can take the effective steps to reduce their body mass index, that is BMI, if needed, which can help those with type 2 diabetes manage their condition without even medications. Using insulin. All people living with type 1 diabetes and some people even living with type 2 diabetes need to administer insulin on their own to keep their blood sugar levels from becoming too high. Various types of insulin are available nowadays and most are grouped by how long their effect lasts. These are rapid-acting, short-acting, intermediate-acting, long-acting, and mixed insulins. Some people will use long-acting insulin to maintain consistently low blood sugar levels. Others may use short-acting insulin or the combination of the insulin types. Whatever the type, a person will usually check their blood sugar levels to determine how much insulin actually they do need. To check blood sugar levels, a person can use a blood glucose monitor, which involves pricking their skin or a combination of a continuous blood glucose monitor and skin pricks. Self-monitoring is the only way a person can find out their blood sugar levels correctly. Assuming the level from any physical symptoms that occur may be dangerous unless a person suspects extremely low sugar and thinks they need a rapid dose of the glucose. How much is too much? Insulin helps people living with diabetes live an active lifestyle. However, it can lead to serious side effects, especially if a person administers it too much. Excessive insulin can cause hypoglycemia or extremely low blood sugar and lead to nausea, sweating, and shaking. It is essential that the people measure insulin carefully, adjust their medications based on their needs, and eat a consistent diet that helps to balance the blood sugar levels as much as possible. Other medications in addition to insulin, other types of drugs are available nowadays that can help alleviate the symptoms. Metformin. Now prescribed in type 2 diabetes, it contributes to lowering the blood sugar by making the insulin more effective. Then SGLT2 inhibitors and GLP-1 receptor agonists prescribed in patients especially with atherosclerotic cardiovascular disease, chronic kidney disease. These are sodium glucose co-transporters, SGLT2 inhibitors, or glucagon-like peptide GLP-1 receptor agonist. For those with atherosclerotic cardiovascular disease and high risk of heart failure, the guidelines advise SGLT2 inhibitor as well as GLP-1 receptor agonist, which work by increasing the amount of insulin the body produces and decreasing the amount of the glucose that enters the bloodstream. It is an injectable form of medication. People may use it with metformin or alone. Side effects include GI problems such as nausea and a loss of appetite. SGLT2 inhibitors are drugs which are used for lowering the blood sugar levels and they work separately from insulin and may be useful for people who are not ready to start using insulin. People can take it by mouth, side effects being high risk of urinary as well as genital infections. While diabetes is manageable, its complications can severely impact daily routine life and some can even be fatal if not treated immediately. Complications of diabetes include dental and gum diseases, eye issues and sight loss, foot problems including numbness leading to ulcers and untreated injuries and cuts, heart diseases, nerve damage such as diabetic neuropathy, stroke, kidney diseases. For those living with type 1 diabetes, administering insulin is the main way to help them manage this condition. For type 2 diabetes, mainstay is the diet and exercise and controlling the weight. The complications of diabetes can be severe including kidney failure and stroke, so managing this condition is very important. So precaution is better than cure. Regularly adopt healthy lifestyle and be aware about your symptoms. If you are having any queries, you are always welcome to ask. Thanks for watching this video.